I have a 21-year-old male came into the emergency department complaining of some sinus pressure, nasal congestion, and a little bit of heaviness in his chest. He does not endorse having chest pain or shortness of breath, just states that his chest feels heavy at times for him. When he came into triage, he did not have any shortness of breath, chest pain, nausea, vomiting, fever, chills. He did complain that he felt stuffy, no point tenderness over his sinus cavities. On auscultation of his lungs, he did have expiratory wheezes throughout all lung fields. He denies any lung history, no asthma, COPD, denies smoking, vaping. Looking back on his history, he does not have any documented respiratory history. However, he was prescribed Singulair, and when asked about why he was prescribed the Singulair, he states that he was given it for allergies. So we obtained a portable chest x-ray on him, got basic blood work, including a CBC, a CMP, a MAG level, and troponin level. Also got an EKG that just showed normal sinus rhythm. On results of his blood work, he did have a slight white count of 12.5. All other lab work came back normal. His chest x-ray came back showing a mild pneumomediastinum. We immediately put in for a CT chest, took him over there. The CT also showed that he had the pneumomediastinum, and he also had some right middle lobe pneumonia started. We started him on doxycycline IV and also Rocephin IV. He got a liter saline fluid bolus. We started him on Duonebs. He got 2 Duoneb treatments while in the emergency department, and we also gave him 125 Solumedrol. The Rocephin was a 2 gram, and the doxycycline was 100 milligrams IV. We referred out to cardiology. We put a referral in for a cardiothoracic surgeon due to him having the pneumomediastinum, just in case they would have to do any type of interventions for a possible chest tube or anything further at that point. The patient does not require any oxygen at this point in time, so the cardiothoracic surgeon was okay with us just admitting him to the hospital to treat for the pneumonia and keep an eye on the pneumomediastinum. Patient denied any coughing, vomiting, so I cannot explain how he got the pneumomediastinum. It was just an incidental finding that we were not expecting to find. He was also negative for flu, COVID, and RSV. My differentials for this patient included flu, it included pneumonia, and also just an upper respiratory infection and sinusitis. I, to say the least, was shocked when we got the results back showing a pneumomediastinum, because the patient did not present with any symptoms that would have even led me to that as being a differential diagnosis. So that was never included in my original differentials. So patient was admitted to the hospital for continuing IV antibiotics, and follow-up treatment with that patient was agreeable, and my attending physician and the nurse practitioner that I'm following was also agreeable to this plan of action.